And one of the issues, I think, I wanted to ask you, Otto, is very relevant to clinicians when they are beginning implant therapy with their patients. Should they say that this may be the beginning of a difficult story? Obviously not like that, but perhaps a story that might bring problems and recurring problems. And if they should, how should they talk to their patients?
Yeah. So I think this is a very important issue. So my talk for this reason will not be that much about heroic surgery to solve complication. It will be much more about how to put the patient in the center of
the softer skills.
Efforts. And for this reason, we have to mainly address most of the complications, we have to be honest, are man-made.
Yes.
So there's a lot we can do as clinicians to avoid complications, taking the right decisions based on a profound knowledge and avoiding complications by doing clinical procedures properly. I think this is the most important message. Still, it can happen, wound healing problems, still we can end up with complications, but this should be based on the enormous body of evidence that we have available today. This should not be something that happens as a general rule. So talking to patients at the very beginning, it's very important, that they really know what's going on, also know the risk, to really have all the information to take their own decisions. So this is, I think, is very, very important, that something can go wrong. They need to know that. But first of all, it's a talk about us, how to avoid complications. I mean, this is the most important thing for the good of our patients.
It's an ethical consideration.
Absolutely.
And every patient is different. So how do you approach your patients with that information when they need an implant?
At the end of the day, it's important to discuss alternatives.
Yes.
Alternatives depending on the very individual situation of a patient. Different circumstances, different preferences, different general health issues in the back. So for every patient, you need to really analyze, if an implant is really the best solution. So give all the information to the patients, offer alternatives. Most of the times there are alternatives, and then at the end the patient should be able to have enough information, to take the decision on his own. Never completely on his own, of course.
Yes.
It's impossible for every patient to understand the medical background to the full extent. Then comes the ethical point as well for us, as it is our obligation as physicians, to really do the best for our patients.
Yeah, and in the case of retreatment being needed, does this then turn into a question of controlling the condition rather than curing?
If it has happened, if we face complications, as you will see, we are in a pure, experimental field. So we have no gold standard techniques. So we have to, improvisation becomes very important, put everything together, and the outcome is questionable if we can really treat complications. So once it has happened, we, and with us the patient, is in trouble. So avoiding complications is the key.